It's Nathan Humphrey, and today we'll be talking about cervical cancer. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Various strains of the human papilloma virus, or HPV, a sexual transmitted infection, plays a role in causing most cervical cancer. A sexual transmitted infection plays a role in causing most cervical cancer. When exposed to HPV, the body immune system typically prevents the virus from doing any harm. In a small percent of people, however, the virus survives for years and contributing to the process that causes some cervical cells to become cancer cells. You can reduce your risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infections. What are some of the symptoms? Early stage cervical cancer generally produce no signs or symptoms. Of most advanced cervical cancer include vaginal bleeding after intercourse, between periods, or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse. When to see a doctor, make an appointment with your doctor if you have any signs or symptoms, and or you may be concerned about anything that you may be feeling. Just ask your doctor or healthcare provider. Causes: cervical cancer begins when healthy cells in the cervix develop changes or mutations in their DNA. A cell's DNA contains the instructions that tell a cell what to do. Healthy cells grow and multiply at a set rate, eventually dying at a set time. The mutation tells the cells to grow and multiply out of control, and they don't die. The accumulating abdominal cells form a mass or tumor. Cancer cells invade nearby tissues and can break off from a tumor to spread, or called metastasis. I'm sorry I put all these names, I'm so sorry. Elsewhere in the body. It isn't clear what causes cervical cancer, but it's certain that HPV plays a role. HPV is very common, and most people with the virus never develop cancer. This means other factors such as your environment or your lifestyle choices also determine whether you will develop cervical cancer. What are some of the types of cervical cancer that you may come across? I'm going to butcher these names, I know I am. Squamous cell carcinoma. This type of cervical cancer begins in the thin, flat cells, squamous cells, lining the outer part of the cervix, which projects into the vagina. Most cervical cancers are this type. Adenocarcinoma. This type of cervical cancer begins in the column-shaped glandular cell that lines the cervix. Sometimes both types of cells are involved in the cervical cancer. Very rarely, cancers occur in other cells in the cervix. What are the risk factors? Many sexual partners. The greater your number of sexual partners, the greater your chances of acquiring HPV. Early sexually active. Having sex at an early age increases your risk of HPV. Other sexual transmitted disease, or STDs or STIs, such as chlamydia, gonorrhea, syphilis, and HIV and AIDS. It increases your risk of HPV. A weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Smoking is associated with squamous cell cervical cancer. Exposure to miscarriage prevention drugs. If your mother took a drug called DES while pregnant in the 1950s, you may have an increased risk of a certain type of cervical cancer called clear cell adenocarcinoma. What are some preventions to reduce your risk of cervical cancer? Ask your doctor about the vaccine, the HPV vaccine. Receiving a vaccine to prevent HPV injections may reduce your risk of cervical cancers and other HPV-related cancers. Asking your doctor whether an HPV vaccine is appropriate for you. Have routine Pap tests. Pap tests can detect precancerous conditions of the cervix, so they can help be monitored or treated in order to prevent cervical cancers. Most medical organizations suggest beginning routine TAP tests at age 21 and repeat them every few years. Practice safe sex, reducing your risk of cervical cancer by taking measures to prevent sexual transmitted infections, such as using a condom every time you have sex, and limiting the number of sexual partners you may have. Don't smoke. If you don't smoke, don't start. If you do smoke, talk to your doctor about strategies to help quitting. Alright guys, I hope you guys enjoyed that one. That was cervical cancer. I'm sorry I butchered most of those names. I'll put them on the screen. I hope you guys are enjoying this like cancer series. I know I just pretty much started, but hopefully it's helping you guys in any way with like the information and stuff like that. I do post like down below like more helpful information if you guys like need more information or have any questions or anything like that. If you do have any questions, just contact your healthcare provider, your doctor, whoever you want, feel comfortable with. I hope you guys are staying safe. I love you guys. See you in the next video.